Let's now have a look at the scapula. So this is the posterior, the back side of the scapula. This is the anterior. So the anterior would be up against the rib cage. Now you notice it has, once again, this is one of those bones that has a very unique shape. You're not going to mistake it for anything. And you can see that, first of all, we have this very large elevated area. And this runs from medial to lateral. And you notice as we move over here, it's going to flatten horizontally. So let's start to give some names to this. So this is the spine of the scapula. Okay, the spine of the scapula as we come here. And this flattened area is the acromion. Now, if I head down here, you can see there is a depression. And of course, this is part of the ball and socket joint of the shoulder. And this is where the head of the humerus will interact with it. Now that we're looking at it like this, just let's take a second and realize, if you compare this to the ball and socket joint in the hip, this is very shallow, and of course this is shallow because it gives us that very wide range of motion. But you can notice that it looks very unstable. Now it is somewhat of an unstable joint and very prone to things like dislocations, but it's soft tissue that helps to hold this in place. And when we come back to visit this joint in terms of the articulation videos, in the future, we'll see that it's the soft tissue that really comes to the rescue of holding this in place. So this depression here is the glenoid cavity. So once again, we have the spine, the acromion, and the glenoid cavity. Now, as I rotate around, remember this is the anterior surface, I have this finger-like projection that comes off here. And let's zoom in so you can really have a good look at it. I'm going to rotate it around. And this is the coracoid process. In review, we have the spine, the flattened acromion, glenoid cavity, and the coracoid process. Now, we do have a few other little features. That is the suprascapular notch right there. Now, it's important to know these terms because, of course, in the world of medicine, it's all about terminology. The other thing is, when we start to study muscles, some of this is going to become handy, because if we know this is the spine of the scapula, well, there's a muscle that sits up here which is called the supraspinatus, above the spine. Muscle down here, which is below the spine, it's the infraspinatus. So let's just rotate so you can have a really good look at it. You can really see the scapula has a very unique shape to it.